It's been a very interesting journey, I must say. And I started working as a transformation program manager at Kettering General Hospital, and done a lot of improvement work around the hospital. Um, so it was one of those things that within the trust, I realized that there's a lot of technology kind of lacking in terms of things that we did. I think my line manager realized that anything I tried to do or bring to staff, I wanted it to be instantaneous. And, things as simple as a staff app, kind of making use of what we had within the hospital. I would put the programs, within there for easy access, information sharing straight away, and collecting even things as easy as surveys for staff just at their fingertips. And I just feel, I felt at that time that, we were lacking technology. And I think they noticed that. And it was one of those, opportunities that came within the trust at the right time. I applied for the job, and I think my passion just kind of shone through in terms of technology and bringing technology to nursing and allied health professionals. And it's very simple for me. It was just a no-brainer for us as an organization at the time, and I think I fell into it. If I have to be honest with you, technology is amazing. Is a thing that we use every day. And that has translated into the work I try to produce when I worked within the hospital. I went to a digital summer school that was really good and eye-opening to just see what else was out there and what other people were doing. I went to One Health Tech. I was able to do a bit of a speech. And these are all just learning as well in terms of how you engage with people outside your organization as well. And it was all part of the process I've been through so far. When it comes to formally doing anything health tech, I haven't done anything health, should I say, IT based yet. I am on the NHS Leadership Academy course, the Ready Now program. That was way before I even started this role. I applied for that, but I do say that it's not that you should not develop yourself. It's a continuous thing that's been happening, that I'm doing within the trust anyway, and the trust acknowledges and supports. So yeah, as the months and years are going, or the days are going, I'm looking at other courses, other kind of conferences to attend, and attending them. So you can learn in terms of that. And prior to that, there was a collaborative working within the NHS that I was lucky to be part of as well. So no, I wouldn't really say specifically before I got the job there was anything that was IT or digitally kind of set to go to. But there are courses out there with the NHS Digital Academy that people can apply for as well. There's quite a few things that, as a CNIO, or should I say digital lead with allied health professional and nursing, that you've got to do. And I think for me, it's looking at act as a voice for nursing and AHPs, and looking at that strategy and kind of the design of the strategy, and how do you bring that to them for it to be understood, and how do you work around it, and looking at also promoting innovation within the hospital, being that person that pulls everyone together, pulls, from your senior stakeholders to your execs, pulling them all together, trying to stop people working in silos, letting, the allied health professionals within the hospital understand that, okay, even that we are working within nursing, we're working within clinical, the background, we are actually bridging, gaps within the organizations, and ensuring that, we're all the interdependencies that are within the organizations are kind of pulled together. And also in terms of that cultural bit as well, letting people understand that we are moving, there is a shift happening, and just being there to be the advocate, and also working with staff to look at their training needs. What do we do to get them more digitally mature as individuals and as an organization? Professionally, I've had worked in different various sectors prior to coming into the NHS. And while being in the NHS, it's been absolutely interesting because my background is an operating department practitioner. I work in theatres, I do recovery. And it's interesting understanding that patient's journey and looking at it from a different perspective and different view, and having that holistic view of that patient's journey. And constantly being able to also help challenge certain decisions that are made within the organization, because I've got theatre background, not a lot of people have the theatre background, and I'm able to use that and understand what's happening within the ward setting. It's been amazing because I was able to do a piece of work about what we're doing right, what needs improving, how do we solve this, when I first got into the organization. And that gave a little bit of an idea of where we were culturally and how people felt. And I think for me, just that enthusiasm as well, I think it's very important in anything you do, especially with digital technology. It's just bringing that enthusiasm, bringing that, kind of drive and push into it, is what I bring. The role is absolutely fantastic. It's actually not knowing what's going to happen the next second or the next minute within the role in terms of what might come at the back of what you've put out there. I think it's very interesting. It's challenging, but I will say it's one of the most rewarding things I've ever done. And also seeing the patients, seeing how they see the transition that we're making. It's absolutely amazing speaking to the patients, finding out what their views are about us moving to the technology world, and even patients saying things like it's about time. So it's very, very interesting in that aspect. And also speaking to staff and seeing how it's made their life easier. It's making them work more efficiently, making them happier, making them feel that what they're doing actually matters now, and that their voice is being heard. I think that for me makes it all worthwhile.